When people hear the words blood pressure medication, they often assume that every pill works in exactly the same way. After all, the goal seems simple: lower blood pressure and protect the heart. But the truth is much more interesting. Two of the most commonly prescribed medications for high blood pressure, Amlodipine and Metoprolol, achieve that goal through completely different mechanisms. Understanding these differences is especially important for adults over the age of 60, because the way a medication works can influence not only your blood pressure, but also how you feel from day to day. Let's begin with Amlodipine. This medication belongs to a group of drugs known as calcium channel blockers. Its primary job is to relax and widen your blood vessels. Imagine your blood vessels as garden hoses. If the hose is narrow, water has to push through with greater pressure. But when the hose widens, water flows much more easily. Amlodipine works in a similar way. By relaxing the muscles that surround your arteries, it allows blood to move through the body with less resistance. As a result, blood pressure decreases, and the heart doesn't have to work as hard to pump blood throughout the body. One important thing to understand is that Amlodipine doesn't usually slow the heart down. Your heart continues beating at roughly the same pace as before, but it benefits from pumping against less resistance. Because of this, many people can continue their normal daily activities without noticing major changes in their heart rate or physical stamina. Of course, every medication has potential side effects, and some people may experience swelling in the ankles, headaches, or facial flushing, especially during the first few weeks. However, these effects are very different from the way another medication, Metoprolol, works. Metoprolol belongs to an entirely different family of medications called beta blockers. Instead of relaxing blood vessels as its main action, Metoprolol works directly on the heart itself. It blocks the effects of stress hormones, such as adrenaline. These hormones normally signal your heart to beat faster and harder, particularly during exercise, emotional stress, or moments of excitement. By reducing the influence of these hormones, Metoprolol slows the heart rate and decreases the force of each heartbeat. This lowers blood pressure while also reducing the amount of oxygen the heart muscle needs. This difference is extremely important. While Amlodipine primarily changes the condition of the blood vessels, Metoprolol changes how the heart responds to the body's demands. That is why doctors choose between these medications based on much more than a blood pressure reading alone. For example, a patient who has experienced a heart attack may benefit greatly from Metoprolol because slowing the heart reduces strain on the damaged heart muscle. Someone with certain abnormal heart rhythms may also need Metoprolol because controlling the heart rate is part of the treatment. On the other hand, a person whose primary problem is uncomplicated high blood pressure may be prescribed Amlodipine because relaxing the arteries may be all that's needed to achieve good blood pressure control. Another important point is that these medications are not competitors. They are tools, and each tool serves a different purpose. In fact, many patients take both medications together because they complement one another. Amlodipine relaxes the blood vessels, while Metoprolol controls the heart's workload. Together, they can provide better blood pressure control than either medication alone, depending on the patient's medical condition. Age also plays a role in how these medications affect the body. As we grow older, our blood vessels naturally become stiffer, and the heart may respond differently to medications than it did years earlier. Kidney function, liver function, and the presence of other medical conditions can all influence how a medication works. This is one reason why a treatment plan that works perfectly for one 65-year-old may not be the best choice for another person of the same age. It is also worth remembering that medications are chosen after considering many factors. Beyond blood pressure, your doctor looks at your heart rate, your history of heart disease, whether you have diabetes, kidney disease, previous strokes, chest pain, irregular heart rhythms, and even the other medications you take. All of these details help determine which medication or combination of medications is likely to provide the greatest benefit with the fewest side effects. This is why comparing Amlodipine and Metoprolol as though one is universally better than the other can be misleading. They were designed to solve different problems. One mainly opens up the blood vessels to improve blood flow, while the other slows and protects the heart by reducing its workload. Both medications have been studied extensively and have helped millions of people reduce their risk of serious complications such as heart attacks, strokes, and heart failure. The most important message to remember is that understanding how these medications work empowers you to have more informed conversations with your healthcare provider. If you've ever wondered why your doctor prescribed one medication instead of another, the answer usually lies in your unique medical history, not simply your blood pressure numbers. Knowing that amlodipine and metoprolol work through entirely different pathways helps explain why the right medication for one person may not be the right medication for someone else. In medicine, the best treatment is never about choosing the strongest pill. It's about choosing the medication that best matches the individual patient's needs. If you've ever started taking metoprolol and noticed that your energy isn't quite what it used to be, you're certainly not alone. Many adults over the age of 60 ask the same question: why do I feel more tired than before? While not everyone experiences this side effect, it's common enough that it's worth understanding why it happens. The answer lies in the unique way metoprolol works inside the body, and how aging changes the way we respond to medications. To understand this, think about what happens when you're active. Whether you're walking up a hill, carrying groceries, gardening, or simply climbing a flight of stairs, your body needs more oxygen and nutrients. To meet that demand, your heart naturally beats faster and pumps more blood to your muscles. This is a normal response that helps you stay active and energetic. Metoprolol changes this response by blocking the effects of adrenaline, the hormone responsible for increasing your heart rate during physical activity or times of stress. This is exactly what makes the medication so valuable for many heart conditions. By slowing the heart and reducing its workload, metoprolol helps lower blood pressure, protects the heart after a heart attack, and can improve symptoms in people with certain heart rhythm disorders and heart failure. However, this same protective effect can also explain why some people notice a decrease in energy. Because the heart doesn't speed up as much during activity, some individuals feel as though they can't keep up with the level of physical effort they once managed easily. They may become tired more quickly during exercise or everyday tasks, not because the medication is harming them, but because it limits how dramatically the heart responds to increased demands. For adults over 60, this effect can be even more noticeable. As we age, our bodies naturally undergo changes. Muscle mass gradually decreases, the cardiovascular system becomes less flexible, and recovery after physical activity often takes longer than it did in younger years. When a medication like metoprolol further slows the heart's response, some older adults become more aware of these normal age-related changes. Activities that once felt effortless may suddenly require more planning and more frequent rest breaks. Some people describe the feeling as constant fatigue, while others simply notice they don't have the same stamina. They may not feel sleepy, but they feel less energetic throughout the day. Others report that they tire sooner during a morning walk or need to sit down after completing household chores. These experiences vary widely from person to person, because everyone sees body responds differently. Another reason fatigue can occur is that metoprolol lowers the resting heart rate. For many patients, this is exactly the desired effect. A slower heart rate allows the heart muscle to work more efficiently and consume less oxygen. But if the heart rate becomes lower than what feels comfortable for a particular individual, some people may experience symptoms such as tiredness, lightheadedness, or reduced exercise tolerance. This is one reason doctors often monitor heart rate and blood pressure after starting the CHA medication or adjusting the dose. It's also important to remember that fatigue doesn't automatically mean metoprolol is the sole cause. Many adults over 60 have other medical conditions that can contribute to low energy, including anemia, thyroid disorders, sleep apnea, diabetes, depression, chronic pain, or simply poor sleep quality. Sometimes several factors occur together, making it difficult to determine exactly what's responsible for the change in energy levels. That's why doctors look at the whole picture, rather than assuming the medication is always to blame. The dosage also matters. Some people tolerate lower doses without any noticeable fatigue, while higher doses may produce more pronounced effects. In many cases, if fatigue becomes bothersome, a healthcare provider may be able to adjust the dose or evaluate whether another medication would be more appropriate. These decisions should always be made carefully, because metoprolol provides significant protection for many heart conditions, and stopping it suddenly can be dangerous. Another interesting point is that many people adapt over time. During the first few weeks after starting metoprolol, The body is adjusting to a slower heart rate and different circulation patterns. As these adjustments occur, some individuals notice that their initial tiredness gradually improves. Others continue taking the medication for years without ever feeling unusually fatigued. This reminds us that side effects are never identical for everyone. Lifestyle habits can also influence how energetic someone feels while taking metoprolol. Staying physically active within your doctor's recommendations, eating a balanced diet, staying hydrated, and getting adequate sleep all support overall energy levels. Gentle, regular exercise can help maintain endurance and muscle strength, even if your heart rate doesn't increase as dramatically during activity. Many people discover they can continue enjoying their favorite activities by pacing themselves and allowing adequate recovery time. The most important takeaway is that feeling more tired while taking metoprolol does not mean the medication is wrong for everyone. For countless patients, the benefits far outweigh the inconvenience of mild fatigue. Metoprolol has helped reduce the risk of heart attacks, control dangerous heart rhythms, improve survival in certain heart conditions, and protect millions of people around the world from serious cardiovascular complications. If you notice persistent fatigue after starting metoprolol, the best approach is not to stop taking the medication on your own. Instead, have an open conversation with your healthcare provider. They can evaluate your symptoms, check your heart rate and blood pressure, review your other medications, and determine whether your tiredness is related to the medication, another medical condition, or a combination of factors. In many cases, there are safe solutions that can improve your quality of life while continuing to protect your heart. Understanding why metoprolol may affect energy levels helps you make informed decisions with your healthcare team and ensures that your treatment remains both safe and effective.